The big thing that gets in the way of our health, it's this process called inflammaging. And it's called the silent agitator. It can accumulate in our kidneys, it can accumulate in the heart, it accumulates in the brain, and inflammaging is one of the causes of Alzheimer's. It can trigger pulmonary diseases, cerebrovascular disease, neuropathy, arthritis, neurological diseases, diabetes, and ocular. Mesenchymal stem cells are one type of stem cell. Then there's hematopoietic stem cells, and they both have different functions. But one of the things they do is they restore the immune regulation. And so getting stem cell IVs is something that I've done for over a decade, at least twice a year. And the thing I notice the most about my body when I get stem cell therapy is I sleep better, I recover better, I feel younger, I feel more vibrant, because what it's doing is down regulating some of the chronic inflammation. Stem cells exist in your body, exosomes exist in your body, plasma is already there. And so all we're looking at is your body's own capability to heal, and how can we accelerate that? All right, welcome everybody to the Health Accelerator Challenge. And today we're going to talk about some interesting things. Let's jump in. So number one, if you guys look at the big thing that gets in the way of our health, it's this process called inflammaging. And it's called the silent agitator. And so if you guys can see my screen here, inflammaging, there's a few things that happen. So the big thing is called cellular senescence. And that's when our cells, they stop replicating in healthy ways. And these senescent cells become what are called zombie cells. And then they start secreting all of these molecules that cause our other cells to age quicker. And it's this low-grade inflammation. And the cellular debris it makes it really hard for our cells to signal. So one of the peptides we use to clear up inflammaging and clear up senescent cells is called FOXO4. And for those of you who use FOXO4, one of the things we have you do is utilizing it 2 or sometimes 3 times a week, but usually twice a week, sometimes once a week, and you don't use it all the time. But what that does is clears out those senescent cells, and on those days you want to be in more of a caloric restriction. We're big advocates of eating, one day a week where you have a protein fast. We're only eating like 50 to 100 grams of protein. The other days out of the week, you want to be building up your muscles and eating a lot of protein. And then you also would want to do more of your VO2 max training on the days you use the FOXO4. So inflammaging is this really interesting thing where they found that it's unlike an acute response where your body gets inflamed to heal a trauma. This is where inflammaging is where your body's in this persistent state of inflammation, and you start feeling really achy in your joints, you feel heavier, you don't recover as quick. And one of the things with inflammaging is our immune system starts to get downregulated. And if you remember in COVID, a lot of us had these complications where we didn't have the protection for the elderly. And we had the healthy people wearing masks and social distancing, and the kids, and they had very little risk, but it was the elderly who were, unfortunately the most compromised. And, I know Cade shared this on a podcast, but his wife's grandparents, they both passed away in more of an assisted living center, and they couldn't even see him. They had to speak through him through like a glass window because they were so afraid that they were going to get sick. But I almost think the cure was worse than the disease. And I think now that we've looked back, we probably think many of you would agree with that. So immunosenescence is when we have these two conditions in our immune system. We have the innate response, and the innate response is when we have, something that triggers, like, let's say you're exposed to a virus and your body kicks in and your immune system recognizes that virus and it activates the macrophages, and you get these inflammatory cytokines, and then you sweep out the infection. So you'll see in your blood labs, many times when we run your blood labs, we'll say, oh, your neutrophils were elevated. Were you noticing being sick? when you around the time you had your blood taken? They're like, no, not really. Or some of you will say, yes, I was, but I feel better now. And so that's when we know your innate immune response kicked in, and that's when you have good immune intelligence. Some of us, if you don't have a good innate immune response, then that's where like thymosin alpha 1 can really help. The adaptive response is this memory that kicks in, and so you start recognizing things and you adapt to those things. And that's kind of the concept of vaccines, for example, is where your body develops antibodies, and those antibodies help you understand and calculate risks. And these are really important parts. But when you have immunosenescence, both your innate response and adaptive response get downregulated. And that's when you get these inflammatory cytokines that drive inflammaging and immunosenescence. And so pretty soon you'll start seeing that your body doesn't recognize what's a threat versus what's friendly. And you have impaired autophagy, meaning you don't have the release of cells. You get changes in proteostasis, you get mitochondrial dysfunction, and then your microbiota gets dysregulated. And that's what leads to aging. And so what happens in disease is when you have inflammation, you'll start to see that this inflammation, it can accumulate in our kidneys, it can accumulate in the heart, it accumulates in the brain, and inflammaging is one of the, causes of Alzheimer's. It can trigger pulmonary diseases, cerebrovascular disease, neuropathy, arthritis, neurological diseases, diabetes, and ocular, so diseases of the eyes. And this chronic inflammation, and by the way, when we're talking chronic inflammation, that's inflammaging. This is when your adaptive immune response is not regulated, and that can lead to a host of diseases that really weaken the system and tire us out. And so the purpose of today's conversation is, what are the things that you can do so that your body never enters into this state of inflammaging? And what is it in the first place? And so some of the things you can do right away is think about the triggers. So, we talk about the epic triggers, and the epic triggers are the emotions. So the emotional stress that trigger, kind of this chronic response, a physical response. We have the pain levels in our body. Pain can cause inflammaging. We have infections that cause it, and then chemical exposure. But some of the drivers, if we start niching it down, sugar can be one, and that would fit under the chemicals. Chemical toxin stress, gut dysbiosis. Your diet, as you know, some of the foods are pretty insane in the United States, the things people eat. I'm always shocked by sedentary lifestyle. The beautiful thing about the human body is it's designed to move, and we're designed to walk and to run. And a sedentary lifestyle, there's no, you can't out eat it, you can't out peptide it, you can't supplement it, you can't out hormone it, out stem cell it. You got to move your body. And so what the research shows is the best way to live a long, healthy life is to have a really robust VO2 max. I mean, if you can take your VO2 max from a lower level to the elite level, you reduce your risk of all-cause mortality by 404%. There's nothing else that even comes close to that. And that's where the peptide Sloop 332, which is an exercise mimicker, similar to 5-amino-1-MQ or like MOD-SC. But these are peptides that can actually help stimulate some of the same pathways and same benefits of exercise. But that doesn't mean, okay, now I don't need to exercise. But even when you do your gut test, make sure you're getting your stool tests at least once a year so you can find hidden infections, this microbiota dysregulation. These are all really important things. The other ways that you can circumvent this inflammaging is through stem cell therapy. And why are stem cells so powerful? Well, if you've never experienced them, and if you're not even sure what they are, well, stem cells are just they're these cells that inform the rest of your body how to function. And mesenchymal stem cells are one type of stem cell. Then there's hematopoietic stem cells, and they both have different functions. But one of the things they do is they restore the immune regulation. And so getting stem cell IVs is something that I've done for over a decade, at least twice a year. And the thing I notice the most about my body when I get stem cell therapy is I sleep better, I recover better, I feel younger, I feel more vibrant, because what it's doing is down regulating some of the chronic inflammation. Because I'm kind of the opposite of a sedentary lifestyle. I love exercising and I frequently overdo it. And so Stem cells have been amazing for me because they do secrete these anti-inflammatory cytokines called IL-10 and TGF-beta. They promote tissue repair and immune recalibration. They resets the immune system signaling without suppressing the immune system. And they also reduce autoimmune markers and inflammatory biomarkers. And even in the animal studies with tumors, cancerous tumors, what they do is they turn off the signaling to those tumors. So your own immune system has an easier chance of clearing out the cancer. And that's really the risk that we have is, as we age, is if our immune system gets downregulated and goes into an immunosenescent state, then it's much harder for our bodies to predict when there's cancer or when there are cells that aren't replicating properly, or it also leads to more insulin resistance. You don't have the right receptors for the testosterone. So you could be taking testosterone, estrogen, progesterone, all these hormones, but your body doesn't know what to do with those proteins because your body's sensing that there is a threat. And so you don't get the benefits. The other thing that can be really helpful is cord plasma. Cord plasma is one of the big innovations that East West has discovered. And I read it. I was looking at doing plasma exchange and plasmapheresis, but I didn't really want to bring in this big dialysis machine, and it was, expensive and risky. And I saw a couple of my patients have injuries from it. And so I said, there's got to be a better way. And so I found that using umbilical cord plasma, this comes from healthy births. It's the blood in the cord, the umbilical cord blood. They send it through a centrifuge and the plasma gets separated out. And that plasma has some of the highest concentrations of these anti-inflammatory molecules that can reverse inflammaging. So IL-10, TGF-beta, IGF-1, HGF, these are all very well known for reversing inflammatory damage. They also have this young cytokine profile. And so for those of you who are wondering, well, what's the benefit? Well, as we age, our blood has a lot of waste in it. And especially if you have, some of these symptoms of inflammaging, your body just doesn't filter out these pro-inflammatory molecules. And so just by putting this umbilical cord plasma, you do 1 concentrated cc or ml as a subcutaneous injection. You can do it in the comfort of your own home, very safe, very well tolerated. What you'll see is that your body becomes more resilient. You sleep better, you feel better, you just have more ability to recover from your workouts. And so, 2 of the main molecules that are so powerful in cord plasma and stem cells are the power of the IL-10 and TGF-beta. And if you've read the book Younger Next Year, which I know several of you on here have read it, it's probably one of the first real hardcore books I read on longevity almost 20 years ago. And I've probably given out 200 of these books. I love it. But one of the things the researchers found, it was actually a doctor and his patient who is a lawyer, and he talked about his journey and how he was able to reverse his age. But he did it through exercise. And as we exercise, what you get is, yes, you get some inflammation in the moment, but then you get this higher expression of IL-10. So instead of having this IL-6 or being in this state of catabolism, or when your body's muscle starts breaking down and loss of proteostasis, what you get is you get better protein synthesis when you have IL-10 expression. And it's the master regulator of immune tolerance. It prevents runaway inflammation. But what it really does from a muscle perspective is it helps you maintain muscle mass. And it helps you maintain the brain density that you need, and the not density like you're dense, but sorry, that didn't come out right, but the brain health. So you have this proper signaling in the brain. Great dendrites, great little synaptic clefts. The TGF-beta plays a crucial role in regulating T cells and dampening the autoimmune or the pro and anti-inflammatory roles. So that keeps the immune system very intelligent. And then what happens is these cytokines help turn off inflammatory pathways like the kappa beta pathway and the STAT3 pathway. So it's really powerful that we have these medicines. And this is the beauty of it is, if you can get ahead of this inflammaging process by using some of these novel therapies, you just accelerate your body's overall capabilities. So plasmapheresis, what it does is it removes inflammatory molecules. Not really a whole lot of regenerative input, but I have done injections into my shoulder when I've re-injured, and it is pretty impressive. Umbilical cord plasma not only removes the old inflammatory signals, but adds these youth promoting factors. So it's like when you're around young kids, how many of you feel a little younger? You feel a little better. That's what this cord plasma can do. And if you look at it, with the plasmapheresis, the cord plasma it includes exosomes, cytokines, peptides, and growth factors, whereas with plasmapheresis, you're getting basically 95% of it is just saline. You're putting water back into your blood with some albumin. And there's some phenomenal research on Alzheimer's. And Dr. David Hasse, a good friend of mine, man, he's done some phenomenal things with this. But when you just compare the two molecules, I think there's something to be said about bathing your blood with these nice, beautiful, this cord plasma. There's fewer risks. It's a much faster procedure. It's just a simple, you can do it IV with the cord plasma, or you can do it, just a subcutaneous injection. So there's no blood filtration, fewer risks, no sedation, better tolerance. And then the umbilical cord plasma does seem to have some promise, at least in the early studies on biological aging. It reverses some of those markers. So something to consider. Stem cells, what it does is it rewrites the immune software. So when you're thinking of this inflammaging process, these secretomes from these mesenchymal stem cells or medicinal signaling cells, a lot of these secretomes are exosomes. And exosomes, one of the things that we're able to do now is we've been able to extract those exosomes from the MSCs, from the same umbilical cord blood and the umbilical cord stem cells. These are all healthy donors. These are beautiful, healthy mothers who have been heavily screened. They have not had the COVID vaccine. They have very healthy profiles. But these exosomes are tiny little vesicles that turn on your body's own stem cells. And that's how you can rewrite the immune software. And they act as little biological instructions that reprogram the dysfunctional immune cells. Exosomes, they carry microRNA, messenger RNA, they carry lipids, proteins that regulate inflammation. They also signal Tregs to increase. They reduce the Th17 and Th1 pro-inflammatory subsets. They deliver anti-inflammatory messages without the cells themselves. And exosome therapy, we're finding that it is a very effective pathway and a very safe pathway to regulate the immune response. Now, on all these, there's ongoing clinical trials and ongoing studies, but from what we're seeing, it's a very safe pathway. The other pathway that we love for inflammaging are peptides. And these are small molecules that have a really big impact because these are just short chains of amino acids. And when these peptides have the right signaling pathways, they can go in there and they can regulate immunity. They regulate your body's ability to heal, to grow new tissue structures, to regulate your hormones. Right now, we have sequenced about 7,000 peptides, and we know about them, but there's over 500 that have been studied for therapeutic use. And many of you are asking, well, are they FDA approved? And if you go to my YouTube channel, go to Regan Archibald on YouTube, and I'd love it if you subscribed and give me a like and leave me a comment in there. Worked really hard on those. We just released our 75th upload, and the channel's growing really quickly. But you'll learn all about these great peptides. And peptides can be a nasal spray, they can be taken orally. And we're finding that if you have the right peptide structures and working with the right pharmacist, you can get these beautiful signals that mimic the same protein structures in your body. So stem cells exist in your body, exosomes exist in your body, plasma is already there. And so all we're looking at is your body's own capability to heal and how can we accelerate that. One of my favorite peptides is Thymosin Alpha 1. There's a fragment of it called Thymogen Alpha 1 for those of you who don't like injections. But what Thymosin Alpha 1's been shown to do is increases the T regulatory cells and natural killer cell activity. It suppresses IL-6 and IL-1 beta, shifting the immune response from inflammatory to regulatory. In clinical trials, this has orphan drug status, but it's approved in over 80 different countries and throughout the world. But it's used for viral infections, cancer, autoimmune conditions, but it resets your immune system. And for those of you who've used it, you just feel stronger. It's kind of like a secret weapon. The other peptide that I love is BPC 157. This is how you heal from the gut outward, and it's naturally excreted by the gastric secretions in your stomach. and it repairs the gut integrity. It reduces NF-kappa beta and tumor necrosis factor alpha levels, TNF-A. These are hallmarks of chronic inflammation. Accelerates bone healing. It enhances blood flow. It enhances wound healing. It promotes muscle, tendon, and tissue repair. It calms down that gut immune axis that fuels autoimmune conditions, so helps alleviate that. It's great for leaky gut, for Crohn's disease, irritable bowel disease, and even musculoskeletal. It improves burns, joint mobility, inflammation, protects your cardiovascular system, can even reduce symptoms of depression. It supports nerve regeneration. It's just a phenomenal, this is like, one of my favorite peptides. So we had a patient that came in who had rheumatoid arthritis, or RA, and Hashimoto's, and she just tapered off the methotrexate after 90 days of peptides and stem cell protocols. Her inflammatory markers dropped by over 50%. Her joint pain reduced. Her morning stiffness was eliminated. Energy and mental clarity returned. No side effects, unlike some of the medications that she experienced. These monthly peptide cycles help sustain long-term remission and complete immune remodulation. So, we're not treating these diseases, but we're just helping get the body back into balance. What we found is if you can stack the right peptides, you have multiple signaling pathways with Thymosin Alpha 1, BPC for the immune remodulation and gut repair. The epitalin helps enhance the thymic output, regulates your pineal glands. You sleep a little better. I think we could all use great sleep. GHK copper helps with inflammation and tissue regeneration. And for those of you who don't like wrinkles, GHK is that's the way to go. You cycle these for 1 to 3 months at a time to prevent receptor downregulation. Just like anything, in the body, the law of entropy, you want to make sure that you are just putting little inputs in and you'll get the highest leverage out of everything you're doing. And so these are some of the ways that we help regulate your body's immune system and help prevent this dangerous condition called inflammaging. And so I know we covered a lot there, and I want to see if you guys have any questions on anything, and we can jump into it. So here's some of the studies that we referenced today. If you want to take a picture of that, and we'll see if we can't provide some links in the show notes. But for those of you who have tried some of these peptides, how many of you have tried Thymosin Alpha 1 and really had a good experience with it? Or maybe you got on some BPC 157. These are phenomenal peptides that can really help accelerate the healing. And then if you have not done anything on like the cord plasma, exosome stem cells, there's just a whole world out there for you. So yeah, appreciate you guys. So your challenge this week, the big health challenge, is see how healthy your immune response is and go drink some really dirty water and see if you get dysentery. Okay, I'm joking. Don't do that. But on the immune side, what you want to do is track your sleep this week. If you're not doing so, I'm going to recommend that. And if you don't have a sleep device, go ahead and get an Oura Ring, a Garmin watch, get something, or even just download the app Sleep Cycle. It's able to measure the amplitude, and it's pretty consistent. That Sleep Cycle, I think, is a free app on your phone. Put your phone on airplane, and it still works. It's just getting inputs from your body, so it's not sending any kind of signals into your body. But it's a very safe way to get some good data on your sleep, because sleep is a big predictor of your immune health. So that is your Health Accelerator challenge today. Check your sleep score, and I will see you next week. And I appreciate you guys being part of our community, and appreciate you being part of the family. Bill, appreciate you, man. And you guys enjoy the rest of your evening. Talk to you soon.